Hello everyone. If you are watching this video, hopefully you're in the Advanced Family Systems class. If not, you might be some random person on YouTube that found this video and is going to learn a little bit about the Bowen approach to family therapy. But in all likelihood, you're in this class. So we're going to get started talking about Bowen family systems. When you think about Bowen family systems, what comes to mind? Well, there are a lot of concepts in Bowen family systems, but the one that usually jumps to the head of the pack is the idea of differentiation of self. So first, I want to just briefly explain that there are 8 foundational concepts in the original presentation of Bowen family systems, but then hone in a little bit more on the practical application side. So Bowen looked at the family through the lens of these foundational concepts, specifically starting off with individuality and togetherness. Key to how Bowen applied his theory is the idea that there is chronic and acute anxiety present within a system, which is one of the reasons it's so important for the therapist to maintain a non-anxious presence as they are modeling the approach to their clients. Now, the emotional system is one of the foundational concepts of Bowen's approach, while at the same time, he seemed to favor having more of a cognitive or a distant way of thinking about and dealing with those strong emotions. So even though he recognized this emotional system, at the same time, he lent more towards taking a step back from those emotions and trying to find an objective space rather than leaning into them. Now, as I mentioned before, one of his most well-known concepts is that of differentiation of self, which I'm going to talk about a little bit more, and these emotional triangles, which link back to the idea of anxiety, and that triangles are often formed in response to anxiety in the system. Then there is the nuclear family emotional system. So Bowen had a concept of the emotional system as a whole, but then specifically the nuclear family emotional system, which is one of the places where the anxiety would be most prevalent. The last two are the multi-generational emotional process and symptom development. And when we think about these last two concepts that he has, it is important to remember that when Bowen was fashioning this theory, a lot of his ideas and the ways in which he would have applied his theory had more of a Western ideology embedded in them rather than an understanding of all the different kinds of cultures, the different kinds of ways that people deal with their emotions and respond to them, and the ways in which that would be applied. And so one of the things in our text that we're using this semester, the socioculturally attuned family therapy, is that third order change in this Bowen family systems approach is facilitated when, from a Bowenian perspective, clients see themselves and their concerns not just as part of that multi-generational family systems, but also as part of ongoing sociocultural systems. So let me say that again, but a little bit differently. We know that there are things like first order change, which might look a little bit more behavioral and might be termed content. But then we switch to what some people would call the second order change of process, where we're not just looking at the behavioral change, but also how that plays out in the patterns and the processes and the family rules, and there being adjustments to those. From a socioculturally attuned perspective, we're now bringing in the larger context and the ways in which those systems also are going to affect what it is that you're seeing in a family. So it's not just about that particular multi-generational family system, but it's also the ongoing sociocultural systems. So let me take a minute just to talk about differentiation of self, which originally would have been thought of as the capacity to think and reflect, not respond automatically to emotional pressures. One of the ways of thinking about this is if there's an argument and somebody says something, your immediate response might be an emotional response because they said something and it made you feel a certain way. And so, are you able to maintain your sense of self, think and reflect in that moment, and then not just respond or be reactive? But therapists have to be careful when they're trying to assess levels of differentiation. And this is one of the points that the authors make specifically about differentiation of self. That what looks like low differentiation may sometimes more appropriately be understood as the effects of discrimination or limited power. And so when you're looking at a family system and saying, are there low levels of differentiation of self? Are there high levels of differentiation of self? Nothing is happening in a vacuum, right? Context matters. And context doesn't just matter as it relates to that family system. Remember, the third order change part also includes the ongoing sociocultural systems that that person and that family is a part of. So, differentiation of self sometimes gets confused with what I call the dictionary definition of differentiation. And so, when I think about the dictionary definition of differentiation, you might say that somebody differentiated their feelings or their thoughts or their ideas from somebody else. And so, when I differentiated myself from them, I set myself apart. And that is certainly one way of thinking about differentiation. But I would say that that is not the way that Bowen thinks about differentiation of self and how this particular theory would apply differentiation of self. Because in a dictionary definition of differentiation, it's about creating this separateness or this space. And so sometimes there will be a misunderstanding that because a child moved away from their family, that they have differentiated themselves from their family. Again, that would be true from a dictionary perspective, but not necessarily speaking to their levels of differentiation personally within their family system, within their context, within that sociocultural system that they're a part of. So when you think about differentiation of self, a lot of it links back to those other principles, both as it relates to emotion and as it relates to anxiety. And the text talks about when differentiation is high, that people are able to apply cultural values in relatively functional ways. But when differentiation is low or in times of distress, cultural values can become exaggerated. And so here again, we're not looking so much at whether somebody is close or distant and making a judgment about their level of differentiation as a result of their closeness or their distance, but instead we're looking at it within the context of the systems that they are a part of, as well as levels of power and any types of imbalances there, possibly discrimination and whether that is present, and then also how they are affected by all of the systems that they are involved in. I want to take a minute now and talk about triangles. So, triangles are driven by anxiety. And I would say that for the most part, when people think of triangles, they tend to think of them as more negative than positive. And certainly in the initial application and understanding of Bowen's approach, he would see triangles as when anxiety increases, eventually one or both people in a dyad will turn to a third person and decrease the anxiety of the dyad because it's spread out in the triangle. And that is one way that triangles are formed. You could see maybe two people are in conflict, so they bring a third person in. We often will see this in family systems where parents aren't getting along and a child is brought in formally or informally to help displace that anxiety. But triangles can also be formed when somebody is observing distress. and they choose to insert themselves into the situation to help relieve or displace or alleviate some of the anxiety. So, although there are times when parents might be disagreeing and one or both of them pulls a child in to help relieve the anxiety that they're feeling, there are also times when a child could observe the distress that their parents are experiencing and they may begin to insert themselves, again, formally or informally. Perhaps they physically insert themselves by coming in between them. Perhaps they start acting out more so that their parents have to pay attention to them and deal with whatever it is that they have going on. But when you think about triangles, and again, they have mostly been talked about from a more negative perspective, it is possible that a triangle can exist in a more positive form. So, for example, if you think about this from a spiritual perspective, that it talks about a cord of 3 strands is not easily broken. Or when you think about relationships, it talks about making sure that God is a part of the relationship. When you have God as a part of a relationship that you have with somebody else, perhaps a significant other, yes, there is a triangle there, but it's not necessarily an unhealthy thing or a negative thing or a bad thing. So, keeping these principles in mind as you think about the application of Bowen family systems is important so that you're not overly pathologizing something based on the way that these principles were originally put together. In our text, there are some practice guidelines that were provided by the authors when you're looking specifically at Bowen family systems. The first we've already talked a little bit about in expanding the presenting problem to larger contexts. And so not thinking about that problem in that limited way, but looking at it within the larger context. You also want to stabilize the immediate situation. And I like to think of this as triage, right? So if somebody comes in, you want to make sure they're stable before you begin with the rest of the treatment that they're going to be receiving. Assessing differentiation through a relational lens, we talked a little bit about that earlier in reference to differentiation of self. So don't just look at it from that individual perspective, but also using the relational perspective. Develop and support critical consciousness with your clients and the family systems that you're working with. Help the client observe their own part in the system. Too often, when clients come to us and they're telling us stories about everything else that's going on, we might be distracted by the stories, by the other people that they're describing to us. But especially when you have just one person, I say to my clients, the rest of the people aren't here. I can only work with you because you're the one that's here. And so helping the client see their part in the system is important. Increasing equity and flexibility in the system. Going back to what we said about differentiation of self and how that can be misunderstood, sometimes there's going to be these power imbalances. And some of that may be influenced not just by the multi-generational transmission process, but by larger societal influences. So how can we increase equity and flexibility in the system to help our clients? And then lastly, plan meetings with the family and with the community. So you may be lucky enough to have a family that comes to see you for therapy. But it's also possible that you may end up working with just one client, one person. And when that happens, you're only getting one perspective. So when possible, you want to see if you can bring in other members of the family system or the community. And when you think about bringing them in, it's yes, suggesting having a meeting with the family and the community, but in instances where that may not be possible, think also about how you might bring them into the room even if they can't be physically present. The last thing I want to mention before we wrap up is the use of genograms. The genograms have been used a lot in Bowen family systems, but they can be used in a variety of family systems approaches, not just Bowen's. When you look at a family and you map it out on a genogram, you're going to be able to see a lot of the patterns and processes. And while it's not necessarily going to be possible to map out all of the other influences that are a part of that system and the ongoing sociocultural systems that they're a part of, it would be helpful to include some notes in and around your genogram to help you have a better understanding of the ways that that's influencing this particular client. Thank you again for your time. And I look forward to talking with you about this more next time we meet.